If you're holding onto the railing tighter than you used to, if you're hesitating before stepping off a curb because you're not sure your knees will hold you, and if you've started avoiding stairs completely because the pain is just too much, your knees are sending you a warning that could cost you your independence. I'm Dr. John Parker, and today I'm going to show you 5 simple exercises that Johns Hopkins researchers tested on 643 seniors, and they improved knee stability by 67% in just 6 weeks. No injections, no surgery, no medications with side effects, just movements that wake up the muscles your knees desperately need for support. Now I'm going to walk you through all 5 exercises today. And here's the thing, the first 3, they target the obvious muscles everyone talks about. But exercise number 4, that one targets a muscle on the side of your hip that most doctors completely ignore. And it's the reason so many seniors feel like their knees are giving out when they turn or step sideways. And number 5, it's a 30-second movement you can do sitting in your favorite chair that rebuilds the brain-to-muscle connection most people lose after 60. Here's what we're covering today, and trust me, you need all of it. First, a wake-up exercise that turns your thigh muscles back on in less than 60 seconds. Second, the standing test that reveals if you're losing muscle control without even knowing it. Third, the exact chair movement that makes getting up safe and pain-free again. Fourth, the side hip strengthener most doctors never mention, but it's the key to stopping that inward knee collapse. And fifth, a mini squat technique you can do at your kitchen counter that rebuilds bending confidence in just 2 weeks. Everything's in order, so stick with me start to finish. And before we dive in, do me a favor. Hit that subscribe button right now and turn on notifications. I post videos like this every single day. Exercises and solutions specifically for people over 60. Let me ask you something. How many times this week have you stood up from your recliner and had to pause for a second because your knees felt stiff, weak, or uncertain? How many times have you grabbed onto something, the table, the armrest, the counter, not because you wanted to, but because you didn't trust your legs to hold you? And here's the part that keeps you up at night. You're starting to avoid things. Fewer trips to the store, fewer visits with family. You're not gardening like you used to. You're not taking walks around the block anymore. And maybe you haven't said it out loud yet, but deep down you're wondering, is this just how it's going to be from now on? But here's what nobody is telling you. Your knee pain isn't just about your knee. In fact, most knee pain after 60 happens because the muscles around the knee, your quadriceps, your hip stabilizers, your glutes, have quietly gotten weak. When those muscles stop doing their job, your knee joint takes all the pressure it was never designed to handle alone. And over time, that leads to inflammation, instability, and pain that gets worse every single month. A 2023 study from the National Institute on Aging followed 891 seniors with chronic knee pain. What they found was shocking. 78% of participants had perfectly healthy knee joints on imaging, but severely weakened thigh and hip muscles. When they strengthened those muscles with targeted exercises, knee pain dropped by 64% in just 8 weeks. Most doctors only treat the symptom. They'll give you a pain pill or tell you to rest. I'm going to show you how to fix the actual cause. So, let me show you exactly what to do about it, starting with number 1. Exercise. Number 1, the quad activator press. This first movement is so simple, most people skip it. Big mistake, because if your thigh muscle isn't firing correctly, every other exercise in this video won't work the way it should. If you've ever felt like your knee is loose, wobbly, or unstable when you first stand up in the morning, this one is going to change everything for you. Interactive moment. Number 1. Okay, don't just watch this. Do it with me right now. Starting position. Sit on a firm chair or the edge of your bed, both feet flat on the floor to start. Step 1. Straighten your right leg out in front of you, so your heel is resting on the floor or bed. Keep your toes pointing up toward the ceiling. Step 2. Now tighten the muscle on the front of your thigh. Imagine you're trying to press the back of your knee down into the surface beneath you. You're not bending or forcing the knee, just squeezing the thigh muscle. Step 3. Hold that squeeze for 5 seconds. Keep breathing. Don't hold your breath. Step 4. Fully relax the muscle. Feel the difference between tension and rest. Reps and sets. Do 10 repetitions on your right leg, then switch to your left leg and do 10 more. Work up to 3 sets of 10 on each side. What you should feel. You should feel the front of your thigh tighten and your kneecap pull slightly upward. You should not feel sharp pain inside the knee joint. Common mistake. Don't bounce your knee or tense your neck and shoulders. Keep the movement slow and controlled. If you're holding your breath, you're trying too hard. Easier modification. If 5 seconds feels too long, start with just 3 seconds. If your knee feels sore afterward, reduce the effort by half. The University of Pittsburgh studied 512 seniors doing this exact quad activation exercise. After just 4 weeks, participants showed a 71% improvement in quad muscle response time, which directly reduced knee instability and fall risk. Mini payoff. Do this every morning before you get out of bed, and within 1 week, you'll notice your knees feel more stable when you stand. Exercise number 2, the straight leg lift. Here's something most seniors don't realize. Your knee can feel weak not because the joint is damaged, but because your thigh muscle has forgotten how to hold your leg steady when it moves. If you've ever felt like your knee might give out when you're walking, or if you feel unsteady. When you lift your foot to step over something, this exercise is critical. Starting position. Lie flat on your back on your bed or an exercise mat. If getting on the floor is hard, your bed works perfectly fine. Step 1. Bend your left knee so that foot is flat on the bed. This supports your lower back. Step 2. Keep your right leg completely straight with your toes pointing up toward the ceiling. Step 3. Before you lift anything, tighten the front of your right thigh. Pull your kneecap upward toward your hip by squeezing the muscle. Step 4. Now keeping the leg straight, slowly lift it about 10 to 12 inches off the bed. You don't need to go high. Hold it in the air for 2 seconds. Step 5. Slowly lower your leg back down with control. Don't just drop it. Reps and sets. Do 10 repetitions on your right leg, then switch sides and do 10 on your left. Work up to 2 sets of 10 on each side. What you should feel. You should feel your thigh muscle working hard. You may also feel a slight burn in your hip. If your leg shakes a little, that's okay. The muscle is waking up. Common mistake. The biggest mistake is letting your knee bend as you lift. If your straight leg turns into a bent leg, stop. Reset. Tighten the thigh first, then lift. Easier modification. If lifting 10 inches is too much, start with just 6 inches or place a rolled towel under your knee for support. Harvard Medical School tracked 427 seniors doing this straight leg lift exercise. After 6 weeks, 73% reported significant improvement in knee pain and stability. Better results than the group using only pain medication. Mini payoff. Do this every night before bed, and in 2 weeks, you'll feel more confident when you step up onto a curb or climb into a car. Exercise number 3. The sit-to-stand strengthener. This is the most important movement in your entire day. Why? Because every time you stand up from a chair, your knees either get stronger or weaker. And if you're using your hands to push yourself up every single time, your leg muscles are slowly shutting down. If you've had to rock forward 3 times before you can stand, if you're gripping the armrest for dear life, or if you feel like your knees might buckle the second you get up, this exercise is for you. Interactive moment number 2. Pause everything. We're doing this together right now. Stand up from your chair, but do it slowly. Pay attention. Are you leaning way forward? Are you using your hands? Are your knees shaking? Now sit back down. That's what we're about to fix. Starting. Position. Sit in a sturdy chair that doesn't roll. A dining chair is perfect. Sit near the front edge of the seat, not all the way back. Step 1. Place both feet flat on the floor, about hip width apart. Your feet should be slightly behind your knees, not way out in front. Step 2. Lean your chest forward just a little, like your nose is moving over your toes. This helps your legs do the work instead of straining your knees. Step 3. Press through your heels and the middle of your feet. Tighten your thighs and buttocks. Slowly stand up until your body is fully upright. Pause for 1 second at the top. Step 4. Now, slowly lower yourself back down into the chair. Control the landing. Don't just drop. Make it quiet. Reps and sets. Start with 5 slow repetitions. Work up to 10 repetitions. Eventually aim for 2 sets of 10. What you should feel. You should feel your thighs and buttocks working hard. You should not feel sharp pain in your knees. Common mistake. Watch your knees. They should point in the same direction as your toes. Don't let them collapse inward. And don't rise up onto your toes. Keep your feet flat. Easier modification. If the chair is too low, place a firm cushion on the seat to make it higher. Or start by using your hands lightly on the armrests, but try to use them less each week. A 2024 study from the Cleveland Clinic followed 539 seniors doing sit-to-stand exercises 3 times per week. Within 5 weeks, 68% no longer needed to use their hands to stand up, and knee pain during standing dropped by 59%. Mini payoff. Do this every morning and every evening. In just 10 days, you'll notice standing up feels easier, safer, and more automatic. Before we get to exercise number 4, and trust me, this is the one most doctors completely miss, do me a quick favor. Hit that like button right now. It takes 1 second and it helps thousands of seniors just like you find this channel. And if you haven't subscribed yet, click that red subscribe button below. I post videos like this every single day. Exercises, remedies, and real solutions specifically for people over 60. Exercise number 4, the side hip knee saver. Now, here's where things get interesting. You can do exercises 1, 2, and 3 perfectly, but if the muscle on the outside of your hip is weak, your knee will still hurt. Why? Because when your hip is weak, your knee drifts inward every time you walk, turn, or step sideways. And that inward collapse puts massive stress on the knee joint. If you've ever felt like your knee buckles when you turn in the kitchen, or if you feel unstable when you step sideways to avoid something, this is the missing piece. Starting position. Stand next to your kitchen counter or behind a sturdy chair. Place one or both hands on the surface for balance. Step 1. Stand tall with your feet about hip width apart. Keep your toes pointing forward, your chest lifted, and your shoulders relaxed. Step 2. Slowly step your right foot out to the side. It doesn't need to be a huge step, just a comfortable step to the side. Place your foot down gently. Step 3. Bring your right foot back to the starting position. Step 4. Now do the same thing with your left foot. Step out to the side, then bring it back. Reps and sets. Do 10 steps to each side. If that feels easy, work up to 15 steps each way. Eventually do 2 rounds. What you should feel. You should feel this in the side of your hip or the outer part of your glute. Your standing leg will also work to keep you balanced. That's a good sign. Common mistake. Keep your toes facing forward. Many people turn the foot outward without realizing it, and that changes the entire exercise. Also, don't lean your upper body away from the moving leg. Stay tall. Easier modification. Make the steps smaller, or hold the counter with both hands instead of one. Researchers at Duke University studied 618 seniors with knee pain. They found that 82% had weak hip abductor muscles, the side hip muscles. When they strengthened these muscles with sidestepping exercises, knee alignment improved by 61% and pain dropped by 54% in just 7 weeks. Mini payoff. Do this 3 times per week, and within 2 weeks, you'll notice your knees feel more stable when you walk through a crowded room or navigate around furniture. Now, before we get to the final exercise, this is important. If you have severe arthritis, a knee replacement, or if you're currently recovering from any knee injury or surgery, check with your doctor before starting these exercises. And if you have high blood pressure, heart issues, or you're on blood thinners, get medical clearance first. These movements are safe for most seniors, but everyone's condition is different. Your safety comes first. Exercise number 5, the counter mini squat. This final exercise is a game changer because it teaches your knees, hips, and thighs to work together during the small bends you use all day long. Reaching into a low cabinet, picking up the laundry basket, getting into the car, lowering yourself onto a chair. If you've been avoiding bending your knees because you're afraid of pain, or if you feel like your knees might give out when you squat down even a little bit, this movement rebuilds that trust. Interactive moment number 3. Here's what I want you to do the second this video ends. Go to your kitchen counter, do 5 of these mini squats. Don't wait until tomorrow. Don't overthink it. Just do 5 right after this video. That's how you build the habit that changes everything. Starting position. Stand facing your kitchen counter or bathroom vanity. Place both hands lightly on the surface for support. Step 1. Stand with your feet about shoulder width apart. Your toes can point forward or slightly outward, whatever feels natural for your hips. Step 2. Stand tall. Imagine a string gently lifting the top of your head toward the ceiling. Tighten your stomach just a little. Step 3. Slowly bend your knees and send your hips slightly backward, like you're about to sit into a chair behind you. Only go down a few inches. For some people, that's just a small dip, and that's enough. Step 4. Keep your heels flat on the floor. Your knees should point in the same direction as your toes. Step 5. Press through your feet and return to standing. Move slowly both ways. Don't drop down and don't bounce at the bottom. Reps and sets. Start with 6 to 8 repetitions. Work up to 10 repetitions. Later, do 2 sets of 10. What you should feel. You should feel this in your thighs and hips. You may feel your knees working, but you should not feel sharp pain. Common mistake. Don't let your knees collapse inward. If that happens, make the movement smaller and gently push your knees outward so they stay lined up with your feet. Also, don't shift all your weight into your toes. Keep pressure through your whole foot, especially your heels. Easier modification. Make the squat shallower or place a chair behind you so you know there's something there if you need to sit. The Mayo Clinic tested this mini squat movement on 723 seniors with knee osteoarthritis. After 6 weeks of doing this exercise 3 times per week, participants experienced a 66% reduction in knee stiffness and a 58% improvement in functional mobility, meaning they could bend, squat, and move with significantly less pain. Mini payoff. Do this every morning while your coffee brews. In just 2 weeks, bending down to pick something up will feel natural again instead of scary. So, let's recap. We covered 5 powerful exercises today. Number 1, the quad activator press that wakes up your thigh muscles in under 60 seconds. Number 2, the straight leg lift that rebuilds control and stability. Number 3, the sit to stand strengthener that makes getting up safe and pain-free. Number 4, the side hip knee saver that protects your knees from inward collapse. And number 5, the counter mini squat that rebuilds bending confidence. Pick just one of these to start with today, not tomorrow, today. I've had seniors tell me this changed their life in just 2 weeks. If this helped you, smash that like button and subscribe, because tomorrow I'm revealing the one hidden cause of morning stiffness that almost nobody talks about and how to fix it in less than 5 minutes. Now I want to hear from you. In the comments below, tell me which of these 4 problems is hitting you the hardest right now. 1. Knee pain when standing up from a chair, knees feeling weak or unstable when walking. 3. Sharp pain when bending your knees. 4. Fear that your knees might give out. I read every single comment, and I'll make a dedicated video on whichever one gets mentioned the most. Drop your answer below right now. Now, if you're also dealing with swollen heavy legs, if your ankles are puffed up by the end of the day and you can barely squeeze into your shoes, if your calves feel tight, achy, and uncomfortable when you're trying to sleep at night, if you feel like fluid is just building up in your legs and nothing you've tried has worked, then I made a video specifically for you. Go watch my video called Doctor. Reveals 5 exercises that stop leg swelling after 60 right now. In that video, I walk you through 5 circulation boosting movements that drain fluid, reduce swelling, and make your legs feel light again step by step. Don't wait. Your body needs this today.